Hello everybody. This mental health video is going to be going over a 3-minute depression assessment. This is by no means meant to serve as a diagnostic tool, but a means of just checking in with yourself and seeing where you stand with a lot of these assessment questions to see what incremental steps you can take to help yourself if you suspect that you're going through depression. Now let's begin. The way that this assessment is measured is in you examining how you've been feeling over a course of a few weeks. So as I ask these questions, you're going to assess it for yourself. The 4 options to rate it into is not at all, several days, more than half the days, and mostly all the days. So that's going to be you seeing, okay, have I been experiencing this? How frequently have I been experiencing this? And that is how you're going to assess yourself. If you answer more than all the days or nearly every day for most of them, then that means that depression can be there. And it's very important to answer and reflect upon it as honestly as possible. Pause this after every question that is asked so you can really assess and be able to have the time to check in with yourself and how you've been feeling these past few weeks. Question number 1, little interest or pleasure in doing things. Number 2, feeling down, depressed, or hopeless. Number 3, trouble falling or staying asleep or sleeping too much. Again, you're going to see if you feel it not at all, some days, more than half the days, or nearly every day. Number 4, feeling tired or having little energy. 5, poor appetite or overeating. 6, feeling bad about yourself or that you're a failure or have let yourself or your family and loved ones down. 7, trouble concentrating on things such as reading a newspaper or watching television or whatever tasks that you have normally in your day-to-day life. 8, moving or speaking so slowly that other people could have noticed that you have changed, your demeanor has changed. 9, thoughts that you would be better off dead or of hurting yourself. 10, if you've had days with issues above, how difficult have these problems made for you at work, home, school, or with other people? With this one, it's assessed a little differently, whereas the other ones are consecutive days. This one, you will assess yourself with not difficult at all, somewhat difficult, very difficult, or extremely difficult. It's very important to be honest with yourself during this, and when you find yourself on the scale where you're experiencing all of these more frequently than not, go ahead and dive in to looking for resources, seek out counseling, or look up articles that may help with depression and to further explore what it is, what it may be, and what resources and steps you can take to support yourself and your mental health. To answer a few frequent questions that come with suspicion of depression, here's a few. So how is depression diagnosed? Depression presents symptoms that range from mild to severe. The feelings of sadness, difficulty sleeping, sleeping too much, feelings of worthiness, unworthiness, guilty, loss of energy or increased fatigue, loss of interest or loss of motivation. Those are the more common ones, and that's why this is an assessment that is a little bit more generalized. So with children and adolescents who are depressed, it may come across as irritable rather than sad as well, a form of defensiveness rather than a feeling of desperation. So it's very important to see how it can have various spectrums, and that's why if you suspect yourself with this, look for the signs in very specific age groups. Look for the signs in very specific parts of your identity, so that way you can know how it will exuberate itself within you. And a healthcare professional typically does look like this. So who can diagnose depression? A primary care physician can be there to help you assess depression or not, and they may refer you to a mental health professional such as a psychiatrist, a psychologist, or a counselor for treatment. In a school environment, a counselor may be able to do that, or a school social worker. And there are many ways and outlets of doing that. There can be online counseling as well. It doesn't always have to require an in-person visit. You can do this through telemedicine, luckily with new advances in technology as well. And to put into spectrum, another commonly asked question is how many people are diagnosed with depression? So in the US alone, around 17.3 million US adults have had one major depressive episode at least one in their life. Some 20% of women and between 10 and 12% of men will experience depression at least once in their life. And it's very important to notice this. Depression may be one episode in life. It may be linked to an event, or it may be linked biologically, chemically, or it may be frequent episodes throughout life, depending on where this person falls in the spectrum, which is why it's very important to go out to a professional, so that way you can see whether this is something that needs temporary relief or something that does need chronic treatment or constant and consistent therapy sessions or whatever it may be that may help you. So it's very important to not take depression lightly and not take any of these symptoms lightly if you have been experiencing them. These are little warning signs telling you that you may need extra help. And remember that seeking out help does not make you weak. It makes you strong because you're taking these incremental steps for your well-being. You are your biggest ally, and you are also the one that can look out for yourself the most. So don't feel afraid to reach out, whatever it may be. Don't feel afraid to look at resources. Don't feel afraid to hone in some tools or coping mechanisms. Your mental health is far more important than anything. I hope that this assessment has been helpful, wherever it may be for you, and that you have a great mental health day. Thank you.